today, keep moving. I keep moving. Whether you have Parkinson's or not, that's what we constantly are saying, is keep moving. And today, under things you not need to know or things to know right now, we're going to talk to a very special person here in a minute, but I just want to tell you that we had a telephone conversation from a lady who's living in an assisted living facility, and she was really beside herself because they won't let her use the gym any longer, and that's her lifeline. She has Parkinson's. She knows that she needs to exercise. So I asked her what she used, and she said the bicycle, and so I tried to tell her about things that she could do at home that might be similar to the bicycle in the gym, but without supervision, they probably aren't going to let her have the bicycle. And then she said, well, nobody uses it, so maybe they could bring it into my apartment. And I told her all the reasons why maybe they couldn't, but maybe they can. And then I gave her some ideas on, if she would maybe sign a waiver of some sort that said, if nobody is using it and you bring it to my apartment and I get hurt while nobody's supervising me, I promise not to sue you, or something. I mean, I don't know what to tell them, but try with that. And if that works, then maybe you can get it into your apartment. Well, she called me not too long ago to let me know the bicycle is in her apartment. Thinking, wow, that's like really amazing. We have connections. We have connections to the universe, and that one worked. Okay. So we know for people with Parkinson's that movement is critical. It's the best medicine that one can use. And it even helps with those complications called constipation that people are sometimes afraid to talk about. But at Rosi Physiotherapy, they're working with us to tell you how you can help yourself and what they are doing to help our Parkinson's world in this little community, because they are super helpful. So Dr. Brandon Rosi is here with me today. Thanks, Brandon. And so I'm going to ask you, maybe we'll start with LSVT Big. Seems to be one of the things that we're utilizing in our community. We sometimes talk about power, PWR as well. What are you and Dr. Samantha doing in those areas for people with Parkinson's?
Good question. So I think your entire community at this point really knows what LSVT Big is, and if they don't, or we can kind of give a brief overcap of that in a second. But in general, what we're doing for any of our patients that were kind of scheduled to have LSVT Big, to start the Big program right before this coronavirus outbreak kind of occurred, is we actually just called all of those patients and said, hey, you know what, because we don't really know what this what this kind of virus is going to do with all the quarantines going on and the stay in home, the stay in place orders, any patients that weren't immediately required to have it because of a significant decline in function, we just said, hey, we're going to put it on pause for a little bit and just wait until we make sure that we can, because once we start the program, we definitely do want to finish it. We don't want to give anybody a quarter or a piece of the program and then they're not going to get it.
And so I think for our audience that doesn't understand what Big is, they need to know that it is an intensive program, an hour a day, 4 hours, an hour a day, 4 days in a row, 4 weeks in a row, right?
Yes. So it's a total of 17 visits if you include the evaluation session, and then 16 sessions, which makes up the whole program. And like you alluded to, it's an hour-long program. Most days it ends up taking a little bit longer than that for 4 consecutive days. And then there's homework for those days, and then additional for those 3 days that you don't have on. And then so 4 consecutive days in a week for 4 consecutive weeks. So because we didn't know what this next month was going to look like, we put all of those patients on hold. That's not to say that we're not treating anybody that either has Parkinson's or needs the Big program, but if they haven't had a significant decline in their function in the last, I'd say 3 to 4 weeks, and that this is just maybe a tune-up session or so, then we're just politely asking all of them, let's just put that a little bit on the side so we can kind of prioritize the ones who are having a little bit harder time physically at this point in time, just because, staff is limited and resources in the entire country right now are very limited.
Yeah, yes. And so, so you're providing services to some of the people with Parkinson's by not having them come in the gym, but you're going to them, or how are you doing that?
Yes, and because of that, because of the shelter-in-place orders, as well as any way that we can to minimize infection or minimize, infection control from our standpoint as healthcare providers, is we figured that we would just come directly to the patient's homes And, that way we have the appropriate PPE, which stands for personal protective equipment, gloves, masks, gowns. We make sure that we wash our hands. And that way we come there, we perform our services, we do the therapy there at their home. They never have to risk getting exposed out to the public, and we can minimize the risk as much as possible. And then we'll just keep them in the homes for now.
Terrific. Now, at the same time as we have the person with Parkinson's who's struggling with issues right now, we have caregivers who are trying to lift their loved one if they fall down or they're stressed out for this or that. And so are you helping caregivers at the same time? Are you teaching them? Are you teaching the caregiver what to do with the person with Parkinson's? How does that work with the caregiver relationship?
Yes, I'm almost always with our patients. Whether, truthfully, whether they have Parkinson's disease or any other, disease in nature that we're treating a patient for, if they're affected enough that they have a caregiver or loved ones that are helping them, we always try to spend as much time as that as possible to get those caregivers as well trained and as well suited to help care for their loved ones, because we're not always going to be there. And not only that, when we train the caregivers what to do, they hold them more accountable.
Absolutely. So do you have any suggestions of what people can be doing to remain active when in their homes, when you are not there supervising them? What can they be doing? My example of the lady that called with the bicycle, I sat back in my chair and said, if you just take your legs and put them up and you pedal as if you were on a bicycle, that's better than if you were just sitting there dormant. Do you have any things that you can express to the listeners on what they can do to remain active in their homes with or without equipment?
Yeah, well, first and foremost, if you're the patient, whether you have Parkinson's or you don't, if you have the ability to walk and you can safely walk, that would be the first thing that any healthcare provider at this point would recommend. If your home is well spaced out enough that you're able to walk in the home, you actually are safe to go outside. You just want to try to pick areas or times to walk outside when maybe there's not a lot of neighbors out there, or the parks, believe it or not, are getting very crowded right now. The weather's beautiful outside. So if you can walk, whether you're using a cane or a walker, or you just have somebody who's there able to walk next to you, and you can do it safely without concerns, then that would be the number one thing to do. Walking is going to help with that respiratory illness, whether you have it or actually prevent you from ever getting it. If not, without kind of giving everybody a general, overview of exercise, because everyone's fitness level is a little bit different, is the one thing that we've been telling our patients is, if you've ever been to any physical therapy session before in the past, even if, say, it was for your arm or your shoulder or a leg, do those exercises. Because like you'd mentioned, Joe, any exercise is going to be better than just kind of sitting there waiting patiently for this quarantine to be over.
Oh, it's movement. I'm doing my own, and I'm so grateful that I have that opportunity and ability to do it. I'm on my elliptical trying to keep my breath support up, etc. So I thank you for this. And if there's anything that you or Dr. Sam would like to add, now is your time. Otherwise, we're going to have anybody who's in our current location can certainly get a hold of you through the website, Wellness Village, on our website. They know how to do that. And we don't want to overwhelm you with new clients right now that are looking for in-home support. But if there's anything you want to add right now, it's time for you.
Sure. Got a couple things, actually. First and foremost, for any of you who is at home or they're safe, firstly, stay at home as much as possible, as long as possible. I know that right now, maybe we're starting to get a little cabin fever, we're getting bored, but it really is the notion of go home, stay at home, and try to minimize how many trips you have to take out into the community. If you are one of those individuals that are, say, at risk population, that would be if you're over the age of 60, if you've had a history of any sort of lung illness, such as thyroid cancer, pulmonary cancer, lung cancer, cystic fibrosis, asthma, emphysema, bronchitis, anything that affects the lungs, you are at a very high risk. Please, please, please stay at home. There are hundreds of services right now. Even your food delivery is now covered completely free from all of the local large grocery chains. If not, there are many individuals who will bring it to you. If you do opt for somebody to bring food, to your home, what we're recommending, or what the CDC is recommending, is have the individual who's bringing the food to you drop it off at your front door, then leave. And then you wait for that individual to have left. That way you don't make contact with that individual who brought you food. Bring the food in, take the food, and immediately transfer them out of whatever carton or containers they came in, put them into another container, make sure they stay fresh so you don't lose the food you just bought, and then immediately throw those original containers away. So that's kind of a way to help minimize any of that contamination regarding food, because of course we do need to eat. And a little sidebar, something, because Joe, you did bring it up about the patient who wanted the bike. A couple gyms right now are kind of running on a similar process like that. If you belong to a country club or you belong to a local gym, some gyms, because they're not able to stay open right now, you can give them a call, and some gyms are allowing you to rent 2 pieces of equipment if you sign them out and you sign a waiver saying that you will promise to bring that equipment back when all of this is said and done. They will let you kind of lease out for free, or most places are doing it for free. They will let you kind of lease out some of those, small carry-on item, exercise equipment. That way you can keep and do a little bit of activity, which is going to be highly, highly beneficial.
That is such incredibly good news. Again, we just have to continue to reach out to find what it is that we need, get it covered. And of course, to our Parkinson's community, Parkinson's Resource Organization is available by phone, available by Zoom, and we're here to support and make sure that people get through this, because together, we can. We're going to get through this, and we can get through it. We just need to be vigilant about our own health and our own safety issues, and that of others, of course. Dr. Brandon, as usual, you and Dr. Sam are just some of my favorite people. Thank you so much for supporting me and Pro and our whole community that's listening to you today. Love you a lot. Talk to you later.
Yep. Thank you.